Hi, I'm Dr. Yvonne Heiser, and I own Three Rivers Dental, and I've been practicing dentistry for 12 years. I'm married and I have one child and a farm full of animals. I have horses, chickens, ducks, pigeons, honeybees, kind of the whole thing. And so that's what we like to do outside of doing dentistry. So I chose Columbia Falls because I'm from a town of 22 people in Minnesota, real small. And so I was looking for a smaller community where I could get to know people, be more personable, and not just have them be more of like a number. I enjoy going out to the local grocery stores and the restaurants and seeing my patients, talking to them and saying hi. I grew up, my parents didn't go to college. I wasn't really set to go to college. I got a scholarship. And so I decided to go to school. I went to school originally for hotel restaurant management. And then I got out and did that for about a year and I hated it. And then I became a stockbroker for a couple of years. And then I went and interviewed for a dental assistant position. I ended up taking the position, and the dentist that I worked for said that I was pretty talented and that I should consider going into dentistry. So I started taking classes on nights and weekends. I was working 60 hours a week. And then nights and weekends I would go to school and study, and got all of my requirements to apply for dental school, and then I got in, and the rest is history. My team is exceptional. They're all very into education as well, and that's part of the requirements for being at this office. They all also spend a lot of time with the patients, getting to know them and their history, and then also education is a part of it. So, we can do our job here, but if the patients don't have the tools or the education to do what it is that they need at home, then our jobs will never be successful. So spending the time to educate patients, showing them pictures, doing demonstrations, allowing them to be able to see what it is that they need to do, all allows our patients to be able to go home and use that information to make their oral health better. We really strive to make sure that people are comfortable when they walk in. So we've got an inviting waiting room with a fireplace and just a relaxing environment. We remodeled back in 2020 to make the rooms more comfortable, the chairs with the latest and greatest technology in the chairs. And then we use lots of different types of technology here. We use cone beam or CBCT to allow us to be able to see 3D. We can look for cancer in the jawbone, we can look for placement of implants, we can look for infection. I look at sinuses, make sure that that's healthy. I also look for carotid arteries and make sure that there's no calcifications in there. So all of that technology allows me to look, deeper into the jaw. I want them to feel comfortable when they walk in the door. We greet our patients by name. And then also just that it's a comfortable experience, that they don't feel like they're at the dental office and that they feel more like they're at home. Also feeling like we've answered all of their questions, given them some information to help whatever it is that they need to go forward in either their medical history or dental history. We are the place for people that want to have in-depth treatment or tailored treatment for their specific needs.